Good morning, guys. I hope we're all sparkly. Gym session done. I've run the dogs. I have an ice bath to follow, but I've got a few little jobs to do first. It is what it is. But I must do my ice bath. Apparently, you get more dopamine than you do from a line of cocaine. Oh, wow. Not sure who your dealer is. No, joke. I am joking. Now, we talk about the importance of mental health. And we talk about the need to express our feelings. And as I've said numerous times before, your body couldn't care less about your emotions. But does that mean we should ignore them and bury them deep down, hide them away, for them only to surface later and you go crazy? No, obviously not. What we should be doing is understanding our physiology and our psychology, which will hopefully allow us to have positive emotions. And it's about building little wins. So you go on the internet, and frankly, it's all virtue signaling. What we need to be doing is, as we've said before, looking after our physiology and our psychology, understanding that we're essentially mirrors, but being kind, being strong, yet kind. And again, it's better to give than it is to receive. So give more, but understand that you need to live by example and get on there and earn your reward. So testosterone deficiency. When you've got testosterone deficiency, your mental health is not 100%. On testosterone replacement therapy, is your mental health suddenly cured? No, because we're all walking wounded and we're all a work in progress. There is no such thing as utopia. We're actually living in the perfect world, but it's about changing perspective, and ultimately that's for you to do. So you go on testosterone replacement therapy and you get healthy hormone levels. So you feel normal. You feel hopefully back to your old self. If you've addressed your sleep, your stress, your nutrition, your exercise, and you've got a positive mindset, and you're going to go forward, you're going to take those necessary steps to be a better human being. So should you tell people about this wonderful, miraculous drug? We've already said it's not miraculous because you've got to put effort in to achieve a reward. And we don't want to take the path of least resistance because it's going to be unsustainable. Again, effort, steps. So testosterone replacement therapy. Do you know guys that have got symptoms of low testosterone and you're not sharing your personal experience with them? Do you have a duty? Do you have a responsibility? Would you say the same thing if somebody was depressed and saying, right, well, I recognize that because I went through that and this is what helped me? You would, wouldn't you? Now, do you have to? No. Should you? Well, I suppose you should. But again, ultimately, it's you. So why would you have to share it? Well, sharing is caring, as we said. So when we talk about mental health, can you have positive mental health, a positive mindset with low testosterone? And the answer to that question is no. So when you go to the GP with your low mood, he's going to do a screen. He's likely going to do full blood count to check to see if you're anemic, and he's going to check to see if you've got thyroid dysregulation. If it's underactive, you're likely to be depressed. If it's overactive, you're likely to be anxious. Because as I said before, hormones, they are dependent, they're not independent, whether that relationship be direct or indirect. But what they don't tend to test for is testosterone, because they fundamentally don't understand the topic and the importance of testosterone in overall well-being. Again, we go to medical school, we go do postgraduate exams. It's about curing disease. So is testosterone deficiency a disease? It's the end result of a lot of things. Those things can be functional, whether it is just leading a stressed lifestyle, not sleeping properly, not eating properly, not training properly. So if you reverse all these things, should your testosterone just come back up to normal? The answer to that question is you would hope, but disappointingly not. So the NHS, if you're a chunky monkey, will just go lose weight and then we'll see what happens to your testosterone in 6 months. How long have we got on this planet? Not that long. And if you understand physiology, you're going to understand that if you go on a severe calorie deficit with pathological low testosterone, you're going to raise your SHBG. And we want to do that naturally, normally, but not in a pathological state, because that's going to lower free testosterone and make you feel even worse. And what are you going to do? Well, you're going to continue trying, but you're going to continue to hit a brick wall. And then eventually you're going to go, sod it. I'm going to start eating. I'm going to start doing the things that are going to give me a reward. So when you see these morbidly obese people, that's a long journey to get there. And you're not going to be able to just reverse all of these things by losing or attempting to lose weight. Things are very complicated, aren't they? Not really complicated. Actually, life is very simple, but we've just lost ourselves, haven't we? So it's disappointing, but it is what it is. What you've got to do right now is take personal responsibility and be personally accountable for your actions. So getting back to the, should you tell people you're on TRT? Now, I'm clearly on testosterone replacement therapy. Now, has it had a profound impact to my life? It's made me feel normal. It's allowed me to wake up in the morning and decide to have a good day. It's allowed me to make the right choices. It's allowed me to go forth into the gym and work harder than everybody else in there. When I get in the gym and I see these kids on their phones, I see them doing their biceps, and I say, listen, mate, triceps, train triceps. It's 2/3 of your arm. It's the strongest part of your arm. Do the biceps at the end. Again, it's about imparting a little bit of wisdom to these guys, because we all want to look good, biceps, chest, but we're upright, aren't we? So you should really be doing posterior chain work. So it is about sharing experiences. And as I said before, you don't have to. Should you? Yes. But it's your journey, and whether you share your experiences to help others is fundamentally a sign of whether you are a good person. Sorry, kind of true. Now, lots of our patients have been suicidal. So again, why would you not want to share this potential treatment that has made a dramatic and sustainable impact to your life? I don't know, guys. What do you think? Leave your comments in the comments section. I can't believe I just said that. Give us a like, share. Listen, hopefully you'll understand my motives are pure, and I want the best outcome for all of you. Whilst I'm speaking to one person, hopefully if we can change one person, we can change the collective and make this world a better place to live in, so that we can go forwards and earn our reward.